Never in the history of the world has any measure been so insidiously designed as to prevent business recovery and to enslave workers. Here's the second one. If you don't stop it, and I don't do it, one of these days you and I are going to spend our sunset years telling our children, our children's children, what it once was like to be a free man. Now, the first quote was from Representative John Tabor in opposing Social Security. And the second quote was from Ronald Reagan in 1961, and that was to oppose Medicaid. When you think of it, the Republicans continue, and I have lots of good friends who are Republicans, but many people who are on the conservative side of the aisle don't care, and at the end of the day, they're okay with people getting hurt. And I think it's not enough for Congressman Faso to hear our words. It's about him having action, to be able to stand up to those powers that be in Congress and in the White House, and to go and say, you know what, I may be a conservative, but I care about people. And clearly, the Affordable Care Act helps people. You've already heard 118,000 people may lose their health insurance here in the 19th Congressional District. We may be losing somewhere in the order of magnitude around 17 million in the Hudson Valley for local government, which means higher taxes. We may be losing somewhere in the order of magnitude of $1 billion statewide for our hospitals. And as, again, Assemblyman Cahill noted, there's a hospital to our immediate left, one that is vital for the city of Kingston and indeed for all the people of Ulster County. So it's not just that we want Congressman Faso to listen, we want him to actually take action.
Yes.
At the end of the day, we need him to stand up, to be steadfast, to go and say, you know what, I may be a conservative, but I care about people. Thank you.
The most vulnerable citizens who fall below the poverty line and people with disabilities. People left without health care harms our families, our cities, and hospitals across the country would see a detrimental loss of funding. The ACA is not perfect, but it was a step in the right direction. It has created real opportunity of preventive care in areas such as cardio, diabetes, and asthma. This has led to less use of patients having to be treated in the emergency room when their conditions were out of control. If President-elect Trump and the Republican and the Senate, Republican-controlled houses, repeal the Affordable Care Act, it would cause millions of people to be without health insurance. And there is no plan in place to cover this. And that is morally wrong and simply irresponsible. They've had 6 years to repeal and replace the ACA, and they have not. This is nothing but legislative baloney. Trickery is what I wanted to say. It's legislative trickery. And we will not go backwards. Patients can't afford it. Our hospitals can't afford it, and the communities we live in cannot afford it. Healthcare is a damn right.
That's right.
Okay? I feel like we're reliving 2009 again. It is healthcare is a right, and everybody should have access to affordable and quality coverage, because access don't mean crap. It's what you get is what's important. And one last thing, President-elect Trump and Congressman John Faso, stop playing games with people's livelihoods.
All right.